This is Dr. Roger Knapp, pediatrician. Let's talk about influenza, not only the disease, but diagnosing it as well as treating it. And influenza is a bad disease. It kills many more people than this recent news media talking about enterovirus 68, and can be quite deadly. The situation, however, is that the people who are more at high risk for complications and even death are the kids that usually have health issues. Infants below 2 years old, kids with heart disease, cancer, lung diseases, immune deficiencies, extreme obesity, pregnant mothers are even also a high-risk category. So there's certain categories that are at higher risk, and you can see those on the CDC site talking about influenza. Those kids definitely need the influenza vaccine, and we recommend all of them. Some studies show that the vaccine shot is maybe a little bit better than the flu mist, and then the other study shows that the flu mist, the nasal drops, is better, and I'm not too really sure that there's a big difference there. I think the flu mist, which is a live virus, is definitely safe. The flu shot does have a little bit of egg in it, but good controlled studies show that if you are mildly allergic to eggs and all you have is just like little hives and not a severe anaphylactic reaction to eggs, that the flu vaccine is safe. We recommend getting the flu vaccine and then waiting around 15 minutes or so to make sure there's no untoward reaction. I've never seen it. It's really not bad to give the flu vaccine in spite of mild allergies to egg. And as a side, we also give vaccines in spite of illnesses. This thing about don't give vaccines because your child is sick, we stopped that policy about a quarter of a century ago, 25 years ago. We found out in studies that the vaccine didn't make the illness worse and the illness didn't make the vaccine worse. And so we recommend continuing vaccines in spite of a mild illness. So if they come in with a cough, cold, and you need your vaccine for the flu, go ahead and let's get the vaccine. The tests for the influenza are not very accurate. Most of the kits that we have is like 50–60% accurate and can miss quite a bit of the cases of flu. 40–50% of them missed. So even the CDC site says that if you're clinically, it looks just like the flu during flu season, go ahead and approach it as if it's the flu without waiting for the results of any tests. There's many times I've seen kids who are in the high-risk categories. I'll go ahead and just treat it, and if the parent really wants the test, I'll run it, but that's not going to change what I do. I'm still going to treat it. Also the CDC site says that the main people that need to be treated with Tamiflu and those flu medications should be the ones that are at high risk. To give everybody the Tamiflu who walks in the door is actually not recommended, because if too many people take the Tamiflu, the medication, the germ will get resistant to it, and then years from now the grandma's going to pass away with the flu because it's immune and it doesn't work. And that's true of any antibiotics for any germ. And in fact, right now there's about 1% of the flu viruses that are now resistant to Tamiflu. So we really want to try to get away with not even treating everybody that has the flu, just those high-risk categories. Some of the doctors will also recommend giving the whole family Tamiflu to prevent them from catching the flu. But you could take that for 5 or 10 days. Now you're going to go back to school or work and get exposed to the flu again. What are you going to do? Take Tamiflu all winter? So I don't recommend treating the whole family with Tamiflu to prevent it unless it's a small infant who's not getting out in public, or an elderly grandparent who's bedridden and not getting out in public. But if you're going out of the house every week, all winter, taking it for a few days to try and prevent it from that contact, I just don't recommend that. I know some people do recommend it, but I just don't, because overdoing the medicine creates resistances. And there are some kids and some adults who throw up the medication. And so it's not a wonderful medicine. And it does not change the risk of pneumonia, which is our main threat of dying from the flu, is the pneumonia that occurs typically the following week. The child will usually have 3 days of pretty good fever, 4th day less fever, 5th day no fever, and any fever after that 5th day, classically 7-10 days into it, is pneumonia or trouble, and it's real important to contact your physician to get antibiotics. But it's the 2nd week of the illness that we see complications, not as much the 1st week. There's rarely complications that 1st week from the virus itself, but most of the complications are the bacterial infections the following week. I hope, again, I didn't confuse you on this issue. We just kind of be conservative, but I'm kind of a middle-of-the-road, common-sense doc, and to treat everybody with medicines, not a good idea, but mainly treat the ones who need it. Thank you. This is Dr. Roger Knapp.